Yeah, so as you were saying, this what was recently published in British Journal of Dermatology is data from a 2-year open label extension study. So this follows on the heels of a 90-day randomized control trial that looked at patients with epidermolysis bullosa who received oleogel S10 or these birch bark extracts to treat the wounds that are associated with EB. And the primary patient population was mainly patients with recessive dystrophic EB, but the study also included patients with dominant dystrophic and junctional EB. So after the initial 90-day randomized control phase where patients were either receiving the treatment or the placebo gel, all patients were able to receive treatment in the open label extension for up to 2 years of treatment. The way that this therapy works, it's a topical product that's applied to all of the open wound areas when the individual's bandages are changed. And the major findings that the open label study showed was that there was a sustained reduction overall in terms of wound burden for these patients, and that overall the therapy is really very safe and did not have any signals in terms of adverse events during that 2-year phase. We certainly want to be aware of kind of both positive and negative impacts of any therapy that's new. And I think it is also important to keep in mind that, as you alluded to, these patients do tend to have a lot of medical needs, and just the nature of EB means that they're going to have problems with, infections or other things, that could be going on. But thankfully, this open label extension did not show that there was an increased risk of problems, with treated wounds, such as infections and whatnot. So I think that was very reassuring also that, there was not an increased risk for other complications that we think about with long-term wounds in patients with EB, such as squamous cell carcinoma. Yeah, those were the main ones. I mean, we really, had kind of looked at overall wound burden that was measured both by kind of an estimate of the percentage of body surface area affected with wounds. We had also looked at a disease severity score called the EB-DASI. And in both of those measures, we could see that there was a decrease, either in terms of the wound surface area or a decrease in the EB-DASI score, which kind of correlates with, decreasing disease activity over the course of the study.